diabetes educator and nurse. I have my own business called In Range Diabetes, Education and Management. And I also have type 1 diabetes, which I've had since I was 10 years old. So I really love to support people with type 1 diabetes, but also type 2 diabetes and gestational and MODY and steroid-induced diabetes. And I like to support them in a way that's possibly a bit different to how other people support people with diabetes. I like to be empathetic and help them to understand the ins and outs of their diabetes, as well as how they can best manage it.
I was diagnosed with type 1 diabetes when I was in my mid-teens, and I often wonder if it would have been better to have been born with it. As being a teen, I had already had that taste for the hanging out with friends, eating bowls of chips, confectionery, and drinking cola. Oh, it really just frustrates me and bothers me to think how quickly people are to just judge when they hear the word diabetes. That they don't actually know that there's different types. Maybe they know just one type, and they automatically go, oh, diabetes, you must have had too much sugar as a child, and judge you in that way, not even knowing that there's a difference between different types, or the fact that it's an autoimmune disease, not something you did to yourself. It's just extremely frustrating. Number 2. I actually had a partner previously that had a relative in the family that was a type 2 diabetic. And every time I was with that family, they would automatically assume that everything that that person had to do, I had to do too. And they were constantly telling me, you can't eat that, and you need to do this, and you should be doing this. And it was all things that didn't actually affect me in a way, because I'm not a type 2 diabetic. But they couldn't see the difference between different types. They didn't understand the differences. And it was just extremely uncomfortable, especially like family gatherings and stuff, where they would constantly be trying to tell me what to do and judge me on what I was doing to take care of myself.
I know that there's a lot of stigma associated with diabetes, but I don't really think I've let it affect me, kind of my emotional well-being or my personal well-being. I think the thing that has affected me most in emotional or personal well-being is probably my diagnosis, although subconsciously. One of the things I was told at diagnosis was that I may not be able to have children, and all the normal things we're told at that stage. And I don't think I really ever thought about it, as I was 10 years old, but when I hit 20s, it was certainly something, it was certainly something that was on my mind more. And it was something that I was very stressed out about, because I didn't know whether I would be able to have babies at all. And this is something that was implanted in my head at that diagnosis stage that didn't really need to be. And I think nowadays, the stigma of good diabetes and bad diabetes is one of the things that maybe kind of affects me most. But it's also funny, it's such a weird term. There is no good diabetes as such. And honestly, I think I prefer to have type 1 diabetes rather than type 2. But when you say you have type 1, people get all sympathetic and, oh, that's the bad one. But at least as a person with type 1 diabetes, I can monitor my blood glucose levels regularly, and I can use insulin to affect those. So I don't see type 1 as a bad thing necessarily. I have a condition, but I also have information, and this gives me the power to manage my condition the way I want to and prevent complications. So it's kind of one of the best conditions to have. We can affect it. So I try not to let it affect my well-being.
I would feel such incredible, guilt for taking medication to save my life. I felt guilty that I was making people around me uncomfortable, making children that are terrified of needles look at me in horror. I was feeling guilt for putting my medication on the table where I could have access to it in meal times because of people around me felt uncomfortable from what was essentially keeping me alive.
I think the stigma associated with diabetes is really the thing that's led me into working in this space, and for that I'm really thankful. When I was diagnosed at 10 years old, I had health professionals that really didn't know much about diabetes, and that really didn't give us very much information about diabetes. So my mum had to go and search for the information, search for the tools I could use to help me. And because of that and the stigma in society towards diabetes, and yeah, that's kind of led me to a career that I love. And I'm so happy that I can support people to have a different relationship with the stigma and with the diabetes that they have. So yeah.
It gives me anger and frustration, but also just great disappointment in humanity. You see, it's really upsetting and annoying to think that there's people out there that can tell you how to better take care of your type 1 diabetes than you that have been living with it all that time. Especially, they can give you this information because their friend's uncle with type 2 diabetes, they know a bit about that. When you have type 1 and they're trying to tell you that they understand you better than you, that's really upsetting.
So what is the most dominating feeling I've experienced from the stigma? I think it's really mostly annoyance and sadness. There are so many diseases and conditions these days, and we all have something going on. Diabetes is largely an invisible condition, but every single person has their own opinion of how you should be managing, despite them not knowing your condition at all, or how it affects you. So it's nice for people to ask questions, but they shouldn't be posing their opinions on your food choices or your management, unless you ask them specific questions about this. So like those times that you test your blood sugar level and you've got someone peering over your shoulder, that's annoying. And you know, feeling guilt for having a high blood sugar level, but you know well that you're normally well managed. That's annoying, and it's kind of sad.
Definitely exposure and education. Whether it be through children's TV programs or regular programs, you've got the ability to put not necessarily the main character, but a character in there who is a type 1 diabetic just doing day-to-day normal things, whether it be checking their blood or injecting insulin, things that they do that then are normalized through just exposure on these programs. And then people can see this and just realize, oh, okay, that is normal. These are normal things. Nobody's reacting weird to them because that is normal. And that's how I should react. So exposure and education.
So how can people help to reduce the stigma of diabetes? A great question, but the only way we can do this is by talking about it more and putting our experience out there, and also using the tools we have in public. So, you know, it's weird for me to reach down into my bra, sure, but pull out your pump in public and do stuff. Do your injections. You know, generally those people that are looking when you're doing those kind of things, they're not judging you. They don't think you're a drug addict or something like that. They're actually curious and they want to know what you're doing. You know, and if they have something bad to say about it, tell them, you know, you're not actually doing a bad thing. You're doing this, and this helps my diabetes, and this helps me to reduce my complications in the long term. And this is just me working as a pancreas, essentially. So yeah, that's my biggest thing. So to reduce the stigma associated with diabetes, put it out there. Put diabetes out in the world. Let people know about it. And if they ask you questions, talk to them openly about it. Have a great day.